from Todd Fields, and I'm 56 years old, live in Stidham, Oklahoma. I have 3 kids and 5 grandkids. I believe it was March of 2020. I had a sore throat for quite a while, and I'd been into the doctor and said it looked pretty rough, and I need to go to oncologist and have it checked out. So, my first diagnosis was the squamous cell carcinoma. Well, they asked me if I'd rather do treatment or just have it taken out, and I told them I'd rather have it taken out. So we did the radical neck dissection, and they took out 32 lymph nodes and both my tonsils, and then 40% of the base of my tongue.
My name is Terry Oliver. I'm 55 years old and I live in Eufaula, Oklahoma. Todd is my brother. He was my big brother, but we were best friends in school. We went to town together. We did a lot of things together, so we were really good friends. And to watch him go through something like this is just really hard, and hard on his kids, hard on me.
It was one of those things you always think going to happen to somebody else, But I had kind of thought, well, something we'll whoop it. Fight it and get it taken care of.
It was just a major surgery. He went through a lot. They said they got it all. He talked to the doctor and he thought it was done. They removed the cancer, he had the surgery, the neck dissection, and we just believed that was the end of it. And I truly believe that that was the end after that. And then he's had the second neck dissection and the second diagnosis.
After the second diagnosis, I really was I was getting more depressed and wasn't really as willing to fight it as much.
It was just very sad for him, and he has a really young daughter, it's just kind of hard on her.
My name is Savannah Fields. My age, I am 13 years old. Todd is my dad. My aunt told me. She told me that he had cancer again. And I remember her picking me up and telling me that. And so we had to go to her house. And Dad was there. Yeah.
It's not easy for me. I'm used to trying to do it all myself. And everybody else, my sister and everybody, she's jumped through all kinds of hoops trying to figure out what I could eat and what I couldn't eat, and so it's put her in a spot too. She's really been over backwards to help me out a lot, and she's had to change all of her stuff up. Having the mask made and all that kind of stuff for the radiation. That was my least favorite part of it all, I guess. And ended up pulling the feeding tube out that first time, and had to go to the hospital, emergency room with the ambulance and all, and actually didn't think I was going to make it. That was the worst pain I'd ever had. But and then the staph infection, when they were, thinking you're getting about to the end of it all, and then something else just piles on, and gets you. And then of course the soreness of the throat, that's a constant.
Well, my dad his throat isn't very good, and he can't swallow, so not very good.
We just think, well, we're not gaining any ground or getting anywhere after all this pain and everything, and still coming back on me. So, thinking about my kids and think, I've got to take care. They're relying on me. That was the main thing that kept me encouraged at the time, and my grandkids. My sister helped encourage me and everything, and keep the spirits up, and think we'll get through this and we'll be all right. And I was just ready to kind of give up for a while there.
My interactions with HNC Living throughout all of his treatment's been awesome. I just text or call. Alyssa's right there texting me back. She texts on weekends if she needs to. Todd's report today, clean bill of health.
Cancer is in remission. My name is Alyssa Lavelle, and I have been here at HNC Living Foundation for almost 4 years. And whenever I received that text message from Terry saying that Todd was in remission, that's exactly the text messages when I get those from patients that make me so excited and fulfilled to come to work every day. My job at HNC Living Foundation is to work with donors and patients every day to get them the services that they need. HNC Living Foundation has served over 4,000 patients since 2014. When you work so closely with these patients and their caregivers, that's when you can anticipate the needs that they might have to get through their journeys with cancer.
I feel like HNC is a part of our support system. I mean, I've helped Todd, a lot, and I love to do that. I love helping people, but I mean, just the break and just the financial side of things has helped so much, because we didn't know how we would get the dentist, how we would get all of his teeth pulled, and how we would get the dentures, because his insurance didn't pay for any of that. And then, just the nutritional drinks were so expensive, and the gas started going really high then. So HNC has just helped us so much financially.
They've been more than helpful with anything and offered, if I need to talk to anybody about anything, to kind of have somebody that could tell me kind of what to expect.
Todd's journey doesn't have a perfect ending. He's still presented with new challenges every day. Almost all of our patients have a similar story about how something so out of their control challenges their life.
It's definitely worthwhile. Agencies is with everything they've helped me with. It's definitely worthwhile to donate or whatever in any way that you can help fund this for people, because it's definitely something that needs to be out there, and it's very helpful. And like I said, they've been more than helpful in anything that I've asked about anything. They've always just anything they could do, they were right there to respond quickly.